Well, taking a look at today's Health Watch, thanks to advances in healthcare and community inclusion, people with Down syndrome are living longer, healthier lives and making meaningful contributions in their communities. So joining me now is Dr. Lindsey Fish with Denver Health. Thank you so much for being here today.
My pleasure.
This is such a wonderful topic to talk about. So first, let's talk about what is Down syndrome and how common is it?
So Down syndrome is a chromosomal shift where somebody gets an extra chromosome number 21. And so it's not a defect or something wrong. It's just a genetic difference. And we see as a result of that changes in development, both in physical development and mental development. It's extremely common, 1 in 770 births in this country, which means about 5,000 children a year are born with Down syndrome.
All right, very interesting. And so what are some of the most common health concerns and how has care improved?
So the most common things are congenital heart defects. Some people have respiratory issues or thyroid conditions, hearing challenges or vision challenges. So those are really the most common from a medical perspective. And the greatest thing about it is now with coordinated care, we've really seen huge changes. So just 40 years ago, someone with Down syndrome would maybe only live to the age of 25, but we now see a life expectancy of 60 for people with Down syndrome. So this is just huge advances when we're able to combine all sorts of things to support them.
That is so wonderful to hear. So why is using person-first language so important when talking about Down syndrome?
So person-first language means identifying the person separate from their medical condition. So we'd say a person with Down syndrome or a child with Down syndrome, as opposed to saying a Down syndrome child. We don't do that for anything else. We don't say a diabetes person.
Right.
So we just identify them as a person with a condition. And that really gives them the respect and dignity that they should have. And we also now use the term of Down syndrome as opposed to Downs syndrome, just to clarify that, because that has been a relatively recent shift. And that's in recognition of the doctor who was able to describe this condition first. And we're really about understanding them as humans and advancing and acknowledging their wonderful pieces of just being a person.
I love all of that. So how does Denver Health support people with Down syndrome and their families? And what is the Global Adult Down Syndrome Clinic?
Yeah, so Denver Health is really proud of our early diagnosis and supportive treatments, not only for the medical conditions, but for other pieces. And it really is a coordinated effort. So yes, we've got great pediatricians, primary care providers, and specialists to help with that. But as you mentioned, our Global Adult Down Syndrome Clinic that really acknowledges there are so many adults now living with Down syndrome that it's not just a pediatric condition. And we take not only the medical care, but we then combine with community resources, education, support to really ensure that patients and their families have all the support around them that they need so that all of their family members with Down syndrome can live great and happy lives.
That is so wonderful. I'm starting to feel like Denver Health, there's nothing you guys don't do.
We really try and do almost everything.
Yes, that is wonderful. So Dr. Fish, thank you so much for being here with us, and we'll see you back here next week. Karen?